Thyroid disorders are increasingly common, affecting millions of people worldwide, often with a range of symptoms that can be difficult to diagnose. The thyroid, a small butterfly-shaped gland located at the base of the neck, plays a crucial role in regulating metabolism, growth, and development by producing hormones such as thyroxine, T4, and triiodothyronine, T3. When this gland becomes overactive or underactive, it can lead to a variety of health problems. This guide aims to offer a comprehensive understanding of thyroid disorders, focusing on their treatment. Whether you have been diagnosed with hypothyroidism, hyperthyroidism, Hashimoto's disease, or another thyroid-related issue, this article will help explain what's happening in your body, how these conditions are diagnosed, and the most effective treatment options available today. The thyroid is part of the endocrine system, which consists of various glands that produce hormones to regulate the body's functions. The thyroid's primary function is to produce hormones that regulate the body's metabolism, the process by which the body converts food into energy. Thyroid hormones also influence heart rate, body temperature, and many other processes that maintain health. When the thyroid gland isn't functioning properly, it can cause a number of symptoms that impact a person's overall well-being. These symptoms can range from fatigue, weight gain, or difficulty losing weight, to anxiety, rapid heart rate, and excessive sweating. Thyroid disorders can be broadly categorized into two groups: overactive thyroid, hyperthyroidism, and underactive thyroid, hypothyroidism. These conditions are often caused by autoimmune diseases, but they can also result from other factors such as iodine deficiency, surgery, or radiation treatment. Hypothyroidism, underactive thyroid hypothyroidism occurs when the thyroid doesn't produce enough thyroid hormones. This leads to a slowing down of bodily processes, such as metabolism. Symptoms of hypothyroidism can include 1. Weight gain. 2. Fatigue. 3. Depression. 4. Dry skin and hair. 5. Cold intolerance. 6. Constipation. 7. Joint and muscle pain. The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disorder in which the body's immune system attacks the thyroid gland. Hyperthyroidism, overactive thyroid hyperthyroidism, is the opposite of hypothyroidism. It occurs when the thyroid gland produces too much thyroid hormone, causing the body's processes to speed up. Symptoms of hyperthyroidism can include 1. Weight loss despite increased appetite. 2. Rapid or irregular heartbeat. 3. Anxiety or irritability. 4. Sweating and heat intolerance. 5. Tremors, shaking hands or fingers. 6. Insomnia. 7. Frequent bowel movements. Graves' disease is the most common cause of hyperthyroidism. It is another autoimmune disorder that causes the thyroid to become overactive. Other thyroid conditions. There are several other thyroid conditions, including 1. Thyroid nodules, lumps or growths in the thyroid that can be benign or malignant. 2. Thyroid cancer, a rare but serious condition that can develop in the thyroid. 3. Goiter, an enlargement of the thyroid gland, which can occur in both hypothyroidism and hyperthyroidism. The first step in treating thyroid issues is an accurate diagnosis. Doctors will typically perform a combination of blood tests, physical exams, and sometimes imaging studies to assess thyroid function. Blood tests. The most common tests include measuring levels of thyroid-stimulating hormone, TSH, T3, and T4. TSH levels are often the most useful in determining thyroid function. High TSH levels generally indicate hypothyroidism, while low TSH levels indicate hyperthyroidism. Ultrasound. This imaging test may be used if there is a suspicion of a thyroid nodule or goiter. Biopsy. In certain cases, A biopsy of thyroid tissue may be necessary to rule out cancer or other conditions. Treatment for hypothyroidism generally focuses on replenishing the thyroid hormones that the body isn't producing enough of. The most common treatment option is thyroid hormone replacement therapy, which typically involves taking synthetic thyroxine, levothyroxine, daily. 1. Levothyroxine, Synthroid, Euthyrox, Eltroxin, etc. Levothyroxine is the most commonly prescribed medication for hypothyroidism. It is a synthetic form of the thyroid hormone T4, which the body can convert into T3 as needed. Levothyroxine is typically taken in pill form once a day. The dosage will vary depending on the patient's age, weight, the severity of the condition, and other individual factors. 2. Monitoring and adjustments. Once treatment begins, doctors will regularly monitor TSH levels to determine if the dosage needs adjustment. It's important to take levothyroxine consistently at the same time every day and to follow the prescribed dosage closely to avoid undertreatment or overtreatment. 3. Dietary considerations. Certain foods and supplements can interfere with thyroid hormone absorption, such as soy, calcium, and iron. It's recommended to take thyroid medication on an empty stomach and avoid eating for at least 30 minutes afterward. 4. Alternative treatments. Some patients explore alternative treatments, such as natural desiccated thyroid, NDT, or herbs. However, these options should be discussed with a healthcare provider, as their effectiveness and safety may vary. Treatment for hyperthyroidism aims to reduce the amount of thyroid hormone being produced and to relieve symptoms. Several options exist, including medications, radioactive iodine therapy, and surgery. 1. Antithyroid medications. The most common medications used to treat hyperthyroidism are antithyroid drugs like methimazole, tapazole, and propylthiouracil, PTU. These medications work by inhibiting the thyroid's ability to produce hormones. They are often used as a first-line treatment or as a short-term solution before other interventions are used. 2. Radioactive iodine therapy. Radioactive iodine, RAA, therapy is a common and effective treatment for hyperthyroidism, especially for patients with Graves' disease. The patient is given a dose of radioactive iodine, which is taken up by the thyroid gland. The radiation destroys overactive thyroid tissue, which reduces the production of thyroid hormones. 3. Beta blockers. While not directly treating the thyroid problem, beta blockers like propranolol, Inderal, can help manage symptoms such as rapid heart rate, anxiety, and tremors. These drugs block the effects of excessive thyroid hormone on the body. 4. Surgery. In some cases, surgery may be required to remove part or all of the thyroid gland. This is often considered when other treatments are ineffective, or if there are large goiters causing difficulty swallowing or breathing. Managing thyroid disease is not just about medication. Making certain lifestyle adjustments can also help manage symptoms and improve overall health. Some tips for managing thyroid disorders include: 1. Healthy diet. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support thyroid health. 2. Regular exercise. Exercise can help manage weight and boost energy levels, especially for those with hypothyroidism. 3. Stress management. Chronic stress can exacerbate thyroid symptoms, so practicing stress reduction techniques such as meditation, yoga, or deep breathing exercises can be beneficial. Thyroid disorders, though common, are highly treatable with the right medical intervention. Whether you are managing hypothyroidism or hyperthyroidism, the key to effective treatment lies in understanding the condition, working closely with a healthcare provider, and making necessary lifestyle changes. This comprehensive guide serves as an introduction to thyroid disease and treatment options, but always consult your doctor for personalized advice and care. Got it? If you need more help in the future, feel free to reach out. Have a great day.